You are working in respiratory medicine, and one of your patients has terminal lung cancer. He has been admitted with a chest infection and has become very weak. His end-of-life wishes have been known for some time. He has always said that he has a fear of dying of thirst and requested that, if he becomes too weak to swallow, he would like to be intravenously hydrated if appropriate. This has been the case all along. However, after a visit from one of his sons, whom you have not met before, he tells you that he has changed his mind and would like his 4 fluids stopped to allow a natural death. Rank and order the following actions in response to this situation. 1 equals most appropriate. 5 equals least appropriate. A. Ask to speak to the patient's son regarding his father's sudden change of mind. B. Call your medical legal insurer asking for advice regarding this patient, who you think may have been coerced by his family. C. Discuss these new views thoroughly with the patient to ensure that you understand what he means completely. D. Speak to the palliative care team about the patient's end-of-life care. E. Speak to your registrar about the patient's sudden change of mind. Answer: C, D, E, B, A. This question deals with the complicated ethical issue of patient coercion. If you feel that patients are behaving in a certain way because of pressures from others, such as family members, staff, or those with a financial interest, it is your duty to find out what the patient actually wants and to protect them from outside influences. In this question, it seems as if the patient had decided upon an end-of-life plan, yet, after only one meeting with an unfamiliar family member, he changed his opinion completely. The best response is to find out what actually happened during that meeting and ask the patient to clarify his new end-of-life wishes. C. The next best response is to speak to the palliative care team, D, who are very experienced in end-of-life ethical issues and will be able to offer support and advice regarding the potential coercion of this patient. Option E is the third best response since, in a complex end-of-life scenario, your registrar or even consultant should be involved to ensure that the patient is fully protected. Seeking legal advice, B, could also be considered if you believe that the patient has been persuaded by his son to withdraw from treatment. You will need to get some advice about how to act within the law, whether to leave the situation alone or go against the patient's new wishes and continue to hydrate him. However, this situation could potentially be resolved without involving external agencies, so escalating to your immediate seniors is more appropriate at this stage. Option A ranks last. You need to be careful when broaching the topic of coercion with his son, as this is a serious accusation. It would be wise to leave this conversation to a senior doctor, if and when it becomes necessary. You're taking routine bloods from a patient on your ward when you accidentally give yourself a needle stick injury. You have had a lot of involvement with this patient and have no reason to suspect that the patient has a communicable disease. Rank and order the following actions in response to this situation. 1 equals most appropriate. 5 equals least appropriate. A. Ask another member of staff to get consent from the patient for HIV and hepatitis testing. B. Decide to forget about it, since you think it is unlikely that the patient has any sort of communicable disease. C. Go back later and consent the patient for HIV and hepatitis testing. D. Inform your ward manager immediately so that the appropriate procedures for a needle stick injury can be followed. E. Send the blood that you have already taken from the patient for HIV and hepatitis testing without gaining consent from the patient. Answer: D, A, C, B. Needle stick injuries pose a difficult situation whereby you, as a doctor, become vulnerable to potential harm from a patient, and both parties require appropriate medical investigation and counseling. Option D is therefore the best course of action since, by reporting this to your ward manager, both you and the patient can receive the correct counseling. A risk assessment can also be undertaken, and post-exposure prophylaxis can be given if necessary. It is always more favorable for an unexposed member of staff to approach the patient to gain consent, A, rather than the exposed one, C, so that the consenting doctor can remain impartial. It is inappropriate to test the patient for communicable diseases without their consent, E, and if a positive result were obtained, this would pose a further ethical and legal dilemma. To do nothing is irresponsible, B. since you put your own health at risk and pose a potential risk to your future patients if you unknowingly contract a serious communicable disease.